Broadcasting from Manhattan Beach and the World Wide Web, you're listening to CHSR, HealthyLife.net.
As a service to our listeners, this program is for general information and entertainment purposes only. CHSR HealthyLife.net does not recommend, endorse, or object to the views, products, or topics expressed or discussed by show hosts or their guests. We suggest you always consult with your own personal, medical, financial, or legal advisor.
It's time now for the Patty Conklin Show, exclusively on HealthyLife.net radio.
Well, hello again. It's Vanessa K. Hall, MD. Patty is off for the whole month of June. In the meantime, I want to welcome my guest, Chaitali Patel, nurse practitioner that I know from Atlanta, who has all these cool things that she does, helps people, has helped many of my clients that we share. And I'm excited to have her on today. And we're going to talk about one of the new modalities that she's offering in her clinic called EBOO for short. It's extracorporeal blood oxygenation and ozonation. It's a mouthful. But first, Chai, thank you for joining me.
Absolutely. Thank you, Dr. Hall. I'm, happy to do a segment with you on the radio show, and it's a pleasure.
So, let's start with just your background because, I am, last year when you gave me your whole sort of story of getting where you are today, I was just blown away. So, just give us some background, where you grew up, how you got to the States to go to college, because it's pretty amazing. I mean, at least I think so.
Yes, of course, I'll be happy to. So my name is Chaitali. I was born and raised in Zambia, which is in Africa. Funny story, the reason I always follow up with it's in Africa is my first day here as a college student on campus. One of my instructors had asked me, to introduce myself and let me know where I was from. And I said, hey, I said my name, and I said I was from Zambia. And the question followed by the instructor was, where's that in India? So I always giggled at that. And I always, tell people I'm from Zambia, and by the way, that's in Africa. So born and raised in Zambia. It's a copper mine right at the border of Democratic Republic of Congo, which is a French colony, and then, of course, Zambia is a British colony. And so those are my roots. Both my parents are Indian, so definitely Indian descent. Therefore, the question of where is it in India. Most of my elementary, middle school, high school have been completed in Zambia under the British system. And I got to college at 14, which a lot of people, and including my patients, find very fascinating. They say, how did you get to college at 14? Well, in the British system, things are a little different. So if you have a child that's excelling in the academic world, they test you out and they get it more challenging so the patients the kids don't lose any interest. So I tested out at 7th grade, 10th, 11th, and 12th, which is about 4 years. And so I took my SATs, my TOEFL, got a scholarship at Southwestern Oklahoma State University. That's where I did my undergrad. I have a computer science.
Hold up, just 1 second. How did you get a scholarship to a school in Oklahoma?
Very interesting question. So when I got my SAT scores, I scored pretty high, and a lot of universities have access to some of the SAT scores, and, you kind of apply to schools, and one of the things they look for as a preliminary screening back thing is the SAT scores. And so they offer scholarships to students that do extremely well in those categories of testing. So based on my results, my SAT results, I was given a full ride scholarship my first year at Southwestern Oklahoma State. That was one of the universities that offered a full ride the first year.
Wow.
So that's how I got to Oklahoma. And then, of course, I graduated from Southwestern Oklahoma with a computer science degree, math minor. I've always wanted to be in medicine, but it's extremely hard to go to medical school or any sort of medicine kind of, endeavor here in the United States being an international student. It's super expensive, It's difficult, it's hard, and so I ended up getting my computer science degree, worked for Bank of America. With the banking industry crash, that was my opportunity to switch into the healthcare field. After applying to nursing school, PA school, pharmacy school, got into nursing quicker, and they were offering the accelerated program. And I attended Stanford University in Birmingham, Alabama, a great university, by the way. It was a private Christian university. I got my accelerated BSN, and then I further went to Walden University and got my nurse practitioner, my master's in nursing. And fast forward, I've always known, again, wanted to have my own practice, wanted to be in medicine, and that's how Vita Infusions evolved. Some part of this journey also involved my own health. I was misdiagnosed by an endocrinologist. I had Hashimoto's, which is an autoimmune thyroid disorder, and, I felt like the system failed me. So I found functional medicine doctors, got treated, and that was my introduction to functional medicine. And I fell in love with it. I found solutions to my own health, and it just made me feel there's more people like me out there that need answers to their health. And you get tired of doctors telling you everything's okay, your labs are normal, you are fine. But people know their bodies, and people know they don't feel well. And that's how Vita Infusions, which is the name of our practice here, evolved. And we've been in business for about approximately 10 years now, offering cutting-edge services, IV therapies, and functional medicine services.
Wow. That's just, every time I think about being 14 years old, I think about, well, what was I doing when I was 14? I certainly wasn't going to a foreign country, having to speak a new language and learn. And, I was just such a little kid. I just can't even imagine. And I grew up in New York. I can't imagine moving from New York to Oklahoma, much less from
It was a
Zambia.
shock, I will tell you. It was a shock.
Yes,
proper British English and then going to Oklahoma.
It must have sounded like a foreign language. You speak English, but
yes. Yes.
The visual on that just kills me. So,
it is.
I think
it was challenging.
Yeah. And then going to Alabama, a whole other experience. And then how'd you get to Atlanta?
So, on and off, job opportunities definitely brought me to Atlanta. I also have an amazing sister. She is also a nurse practitioner in the regenerative field. She got married, met somebody here, and moved to Atlanta. And, I didn't want to be too far from my family, so I followed her. That was another reason I came to Atlanta.
I see. So, and we met through a mutual client, excuse me,
yes.
And that was very fortunate for me, I will say, because I've learned
Likewise.
a lot of things from you. As you know, I got burned out and got out of doing much clinical medicine, and so it's kind of fun hearing about what you're doing and your clients and the different things, and also just being a client of yours, and then having friends of mine be clients of yours and hearing these raving reviews of how they're doing and, my own benefits. So you, like me, and I think maybe like a lot of people, we're our own guinea pig in some regards.
Yes.
And clearly, I think that is what you stated earlier about, going to a doctor and they say, oh, your blood tests are normal, so you're fine, and it's so dismissive, and it's this attitude of, oh, it's all in your head. Sort of reminds me of, way back, decades ago, women were hysterical, and they just needed, some antidepressants and anti-anxiety meds and then go sit in the corner when there are actual real medical issues going on. And I think that you and I both have discovered the limitations of allopathic testing.
That is correct.
You know, when you do a basic thyroid panel, you miss things. I mean, excuse me, just a simple, you know, when you understand the physiology, then you can understand, you know, it's more than just this one test. I mean, a TSH is great, it doesn't give you the whole picture. And if someone is still just sounding like thyroid condition, in this example, you know, dig deeper, and that's the beauty of functional medicine, which really looking at the pathways, looking at understanding that you don't go from well to unwell in this one big step. I mean, unless, of course, you're hit by a truck. But there are incremental dysfunctions along the way, and in the allopathic model, it's really not picked up until you're, you know, the cow's out of the barn. And so what you're doing is helping people, certainly people are coming to you ill, but some people come to you unwell, and they know that they don't feel well, but there's no diagnosis in that allopathic model that can be picked up. And you're applying these other principles and uncovering the dysfunction and then doing the things to correct it. That, you know, is inspiring for me, and it's also, it's fun. It's fun to do. So now, the main topic today I want to talk about is EBOO, but I want you to tell us about some of the other things that you do in the practice, and maybe, you know, an example of a home run where someone is just so much better. I know you have lots of them. It might be hard to pick one, but
pick one, yes.
Yeah,
so,
just an overview.
So Vitamin infusions, you know, my passion for infusions began when I was seeing a physician here locally in Atlanta. I briefly worked for him for a couple years, and then once I got my nurse practitioner licensure, you know, I've always wanted to have my own practice. So I'm very thankful for his mentorship. I'm very thankful for his introduction to functional medicine. You know, so that's how I got into it, and I appreciate him even just mentoring me through the process of becoming a functional medicine provider. Vitamin infusions emerged as a functional medicine clinic whose expertise was infusion therapy. And how that sort of became was combining my background in trauma medicine. You know, I did work for Grady here in Atlanta. I'm a trauma burn nurse.
Wow.
So bringing in that experience, my emergency room experiences, my ICU experiences, which is all around the critical care, you know, we wait until people are extremely sick to be able to help them. And so, you know, when I was in NT school, one of my questions in the ER, you know, you would get a lot of different kind of people walking into the emergency room. And some of this stuff is preventative. You know, some of this stuff, it's like, okay, well, this is not the setting that we need to talk about this. There's got to be another way to get these people better before they get to the red zone or get to the desperate zone. And so Vitamin Infusion started to look at patients chronically ill, but they were not ill enough to fit into a internal medicine practice, primary care practice, or even the emergency room. So these were patients that have a vast majority of symptoms. And when they're getting, like we mentioned, getting their annual physical labs or getting their basic lab panels by their providers, nothing would show up in their blood panels. And as we already know, our society in this day and time deals with specialties, right? So if you have a stomach issue or a gut issue, you go see a GI specialist. If you're having a cardiology issue, you go see a cardiologist. And the primary care here in the United States, you know, you've got to see how many patients they see in a day. And as you already know by running a primary care practice, you can only spend 15 minutes with a client or a patient. And you're supposed to determine, one, their diagnosis codes, two, the labs they're going to need, And 3, what the plan is preliminary going to be once these labs come back. I mean, you're doing all of this in 15 minutes. You're also billing insurance, you know. So that kind of takes away a lot of time that's required to know your patient. The beauty about functional medicine clinics like mine is that we spend 45 minutes to 90 minutes if needed to obtain patient history. And a lot of the patient history will determine which direction or what the root cause possibly may be. And so the clinic offers IV infusion as our goal, you know, that's our boasty, you know, treatments. I like to call it our happy place because infusions is where we're all happy. But the functional medicine services will allow us to take a deeper dive into a patient's health to determine the therapies needed to resolve. It's great to figure out what the problem is, but it's even greater to find a solution. So I always tell my patients, you can get your lab work, get a diagnosis, but then the million-dollar question on the table for most providers is, what are we going to do about this?
Right.
And that's where infusion therapies help, right? So, like you mentioned, there's a soft line or a very gray line that people cross over from being well to being unwell. And figuring out how they got there, part of their health journey, determines solutions. And IVs offer a quick, noticeable solution where the patient feels like they're getting something accomplished, and they will then be more compliant in the treatment therapies that you're providing them. You've got plenty of clinics that will provide solutions, and patients will be there for 6 months, 9 months, 12 months, 18 months, and they have no resolution of any of their symptoms they came in with.
Yes. You know, it's so... it's human nature, right? It's the psychology. When you get a result and you feel better, then you're more engaged and more inclined to follow through with the recommendations of the practitioner. Like you said, I mean, I had that primary care practice and I was seeing 35 or 40 people a day, and, you know, what I was doing is spending as little time with the minor things like rashes and colds to try to make up time to be able to spend more time with people who had more complex things going on. And I had a lot of Medicare elderly people on a laundry list of medicines with multiple chronic conditions. And I realized that I was not helping people actually get well. I was managing conditions. You know, here's a pill to keep your blood sugar down, but you still feel bad. You know, here's a pill for your blood pressure. But what was I able to do to help people get well? And was very limited because so much of it is based on really digging into the history. One of my residency professors said, if you listen to your patient, they will tell you what's going on. You know, but in this medical model, if you can't listen to someone in 15 minutes and really hear what's going on, and I think more importantly, you can't develop the trust needed for people to really open up and share with you what's going on and feel comfortable saying things that in their head they're going, oh, that's stupid, that has nothing to do with it, and then they don't tell you, but it's actually an important piece of the puzzle. You know, and also, like you said, you know, people come up with a GI problem, they go to the GI doctor, and we know, you know, that it may be some other issue, or they have a rash, or they have a whatever, and it's actually a GI problem. And that's the holistic look at the individual, as opposed to starting from the symptom, and let's work on the symptom. And I know myself, and like you, when you see the improvements in a person's overall wellness, as well as whatever condition you're managing, we see that sort of global improvement. You can't unsee it, particularly things like that really, you know, hit me between the eye when removing a food, an everyday regular food from someone's diet, and their asthma and their reflux and their fibromyalgia go away. I mean, we're talking
that is
cure. We're talking that person has reversed the trajectory they were on, and they are going away from unwell and back into wellness. And I think that is the joy of what you do. Get well, as opposed to what I saw so often in practice is that the numbers look good, the blood pressure's good, the blood sugar's good, the A1C's good, but the person doesn't feel well. And so we'll come back after the break and carry on with this conversation. And Chai, we'll be right back.
Yes, we will.
Want to get that man or woman out of your mind? How about being in the right state of mind for getting that job promotion or staying positive to help boost your immune system? Want to break those old habits? Then it's time for an emotional cellular cleansing with Patty Conklin. You'll get a private 3-hour session in person by phone or by Zoom with 3 months of follow-up appointments, plus email support. But you'll have to do the work, and homework materials are included. Find out more or to book your appointment, visit pattyconklin.com. That's pattyconklin.com.
Audiobooks gives you instant access to over 50,000 of the best sellers and hottest book titles in romance, mystery, fiction, and many other genres. Just visit HealthyLife.net's advertiser page and click on Audiobooks to get started.
If you're wondering if Patty can help you heal, why not book a free 15-minute consultation either by phone or by Zoom? It's a great way to see which of Patty's services is right for you. You'll discuss her services in detail and how they can apply to your specific situation. It's really a great place to start, and you can sign up for your free consultation by phone or Zoom on Patty's website, pattyconklin.com. That's pattyconklin.com. Get the help you need today. Sign up for your free consultation at pattyconklin.com.
ASMC, the premier German company that supplies everything for adventure, from outdoor clothes to outdoor gear, even backpacks. Lots of quality and lots of specials. To start your adventure, go to HealthyLife.net's advertiser page and click on ASMC.
Okay, I get it. You're a doubting Thomas, and you don't want to pay for something unless you can know what it's all about. Well, now you can find out just what Patty Conklin's energy healing is all about. Go to pattyconklin.com to sign up for her free group energy adjustment, held every Wednesday from 12 p.m. to 12:30 p.m. Eastern Time. Experience for yourself the transformative energy designed to bring calm and healing to your life. Space is limited, so sign up now. Go to pattyconklin.com, click on Services, and you're there.
Where positive people and radio unite. HealthyLife.net.
Okay, we are back, folks, with Chaitali Patel, and we just finished talking about her fascinating background, getting a full ride to University in Oklahoma State, I think you said, at the age of 14, coming from Zambia in Africa.
That is correct.
After your British education, I mean, just amazing. And then, sort of your pathway to get to functional medicine, solving your own medical problems and being introduced to functional medicine and seeing just how effective it really is. So, and we talked a little bit about some of the other things that you do in practice. And so let's switch gears a little bit, and let's start with EBOO, extracorporeal blood oxygenation and ozonation. How did you come across this? I mean,
very interesting start. When we decided to launch Vita Infusions. You know, one of the things was to offer functional medicine with IV therapy, and the first couple patients that actually came in as patients at Vita were oncology patients. And it's such a touchy topic. It's a very, you know, close-knit relationship with your providers. There's a lot of differences. At that time, 10 years ago, there's a lot of differences between the conventional treatments in cancer or oncology and the integrative cancer options. So my first introduction to ozone was at an integrative conference for cancer therapies. And there's an amazing naturopathic doctor that is, most of you guys may possibly know him as Dr. Paul Anderson. So if he's listening to this podcast, Dr. Paul, you're amazing. He is a great speaker. He's a proponent of, you know, oncology patients. He's bringing a lot for us. He's doing some great work at the legislative levels and FDA levels on bringing integrative cancer therapy to the United States. So that was my first introduction to ozone. And then you start looking at what ozone does, right? So the history of ozone and how it started. In the year 1840, I mean, ozone's been around for a very long time. Some people have heard of it, some people have not. But just going back to a little summary of timeline on ozone, in the 1840s, ozone was discovered. It was a gas discovered by Dr. Schoenbein. You probably said his name wrong, but that's how it started. In the early 1900s, again, you know, most of the European countries started to use it in the medical facilities and the fields and things like that. Really where the cutting edge of ozone started was World War I, where, you know, they started using ozone as a disinfectant for wounds, and it also accelerated healing due to its strong antiseptic properties. So they were more natural ways rather than the allopathic ways to use in terms of wounds and stuff in World War I. Progressed in the 1950s and 80s, it was a widespread medical use began in Europe, really from the cancer world, really Europe. If you look at countries like Italy, Germany, they had a lot to do with putting ozone on the grid in medical use. EBOO was like a step further of ozone. What EBOO was ozone on steroids. It was a better, more efficient way of giving ozone while returning it to the patient at the same time simultaneously. So EBOO, I have a little analogy for my patients for EBOO. I always tell them, think of it like a blood reset, okay? It's like a cellular tune-up. It delivers ozone-generated messengers that activate the body's repair, defense, and detox systems without directly damaging tissues. When you talk about detox and repair in patients, you got to look at the cellular level of what's going on. And cellular inflammation is very common nowadays with just the toxins that we're around, you know, our food, our water, the mold, you know, just everything almost is attacking the body. So having a really gentle way of repairing the body without damaging tissue is super important and essential in a lot of the chronic conditions nowadays. So we have two separate machines at the office. We have an ozone machine. That's a little different. We have to draw the patient's blood. Of course, there's labs required. One of the most important labs for both therapies, because it's an oxidative therapy, is a G6PD lab. Any of the providers that are doing this should really focus on getting those labs, because if they have a G6PD deficiency, they are not a candidate for ozone or EBOO. So it's not for everybody.
Mm-hmm.
So that's something that's very exciting and interesting, because once these therapies come out and people research it, there's information like fine print that never gets, you know, told to patients. So safety considerations for both therapies, you know, should only be administered by trained professionals. Make sure your provider is trained. And, you know, if you have any blood disorders, blood clotting disorders, blood bleeding disorders, which, you know, some patients can have, there's contraindications to that. You should not be doing it. And then also things like severe anemia. One of the ways that ozone is transported in the body is using an RBC, the red blood cell of the body. So if you have anemia, your red blood cell content, your hemoglobin content, those are low, right? So it's not going to have an effective delivery system. So severe anemia is contraindicated. Uncontrolled hyperthyroidism is one, and pregnancy is always there, because you definitely don't want to mess with pregnant women. But those are your safety considerations for both ozone and EBOO, and I think patients should know if they are a candidate or not, and that's something that a provider can definitely screen.
Yes.
two machines, ozone and EBOO. Ozone, you draw the patient's blood, ozonate it in a saline bag with a little bit of heparin. It changes color from dark red to cherry red. That's when you know it's working, and then you infuse it back into the patient. On the EBOO machine, it's a slightly little different capacity. What happens is you get two IV lines. It's like a dialysis machine almost. You get one line pulls the blood out of the patient, enters a chamber. The chamber has a filter. Two things happen in the chamber. One is filtration. The second is oxygenation and ozonation. And all of those three processes happen simultaneously. Once the ozonation and oxygenation has happened, it is then run through UBI light to eradicate any other pathogens that are present, and then it's re-delivered back into the patient with the second line. So it's like a mini dialysis center when we're doing these.
Wow. So it's sort of what it reminds me of is donating platelets. I don't know if you've ever done that, but your one arm is the blood's going out, it's getting filtered, gets the platelets removed, and then they run it back into your other line. How long does this take? I mean, and how much blood is actually coming out of you and going back in you?
So on the ozone machine, there is a variation. It's anywhere between 40 to 120 mLs because you're pulling it manually. On the EBOO machine, depending on the manufacturer of the machine, you are filtering and oxygenating and ozonating at least 2 liters at a time. And it takes anywhere between 50 minutes to 90 minutes.
So, and what, the body has liters of blood? Something like that?
6, depending.
So, and how many sessions does a person typically have?
So the general rule of thumb is 4 to 6 sessions. Of course, it depends on, the disease condition, the goals that we're trying to achieve, what is really that we're trying to do with the patient when it comes to EBOO. What is our goal? And EBOO is never a standalone treatment. So one of the listeners to know is that EBOO should not be used by itself. There's other things that EBOO, should be used with. Those can include IV antioxidants, chelation therapies, binders, peptide therapies, and antimicrobial, including Myers cocktail type therapies where you're reintroducing nutrients and minerals back into the blood.
Okay, so we need to take a break. They go by so fast. And we'll come back. We'll pick up where we left off talking about the sort of logistics of having EBOO treatment and what kinds of things it's useful for. And we'll be right back.
The pulse of the blood in your veins means you're alive, but a high or low pulse could mean you're not in balance, which could cause problems. But now Patty Conklin has found 3 ways that can constantly make sure your pulse is kept in balance so you can move easier through life. Subscribe to Patty's Healing Pulse today. It has a plethora of things to do, discounts, book club, and so much more. Visit pattyconklin.com to find out more about Patty's Healing Pulse subscriptions. That's pattyconklin.com.
Reach your health and fitness goals. Whether you want to lose weight, learn to dance, build muscle, or just live healthy, Beachbody gives you unlimited access to the nation's most popular fitness and weight loss solutions. Visit our advertiser page and click on Beachbody now.
You may not be in the same room or even the same country, but Patty Conklin's remote energy work can help you heal whether you have an illness, emotional wounds, or are in spiritual turmoil. And she can do it remotely. You can choose your session time, too, starting from 30 minutes, 3 hours, or even 6-hour sessions. Healing energy. Healing you no matter where you are. Visit pattyconklin.com, scroll down to remote healing, and book your appointment now. That's remote healing at pattyconklin.com.
For the best in business class travel, count on Cheapo Air. Cheapo Air has the best price guarantee, 24/7 customer service, and easy booking online or by phone. To experience your hassle-free journey, start by going to HealthyLife.net's advertiser page and click on Cheapo Air.
If you're on PattyConklin.com, you might want to visit her store. There you can inexpensively buy powerful visualizations on a plethora of subjects, all to help you heal, help rebuild your immune system, work with color or tonal energy, help remove fear and depression, and so much more. Plus, you can get Patty's best-selling book at her store, To Be Your Best Too. God Within is a great book to teach you how to use the lost knowledge of the universe to impact your physical life today. Visit her store at PattyConklin.com. You'll be glad you did. PattyConklin.com.
Expanding your mind. HealthyLife.net.
Okay, folks, we are back with Chaitali Patel when we are talking about EBOO, extracorporeal blood oxygenation and ozonation. And I would like you to just sort of describe again for folks so they can sort of picture this in their head what a session is like. And then after that, I'd like to shift into what conditions this is particularly good for.
Yeah, absolutely. So a typical appointment, we do block off our clinic schedules. We do one patient at a time. We definitely take safety very seriously. We currently our protocol, and it's different from many clinics, but we have a nurse practitioner RN. They both are at the site of the patient. So it would be myself and a clinical RN. Patient typically comes in. We advise patients to have a high-protein, high-fat meal prior to their appointment. One of the things that EBOO can do is it filters out a lot of your blood chemistry, such as blood sugar. You could have a blood sugar drop, which is you don't want to have an adverse event on your IV chair. So they come in, we get vital signs, we get a baseline blood sugar. They get both IVs, usually typically a 20 gauge. For people that don't know gauges, it's not a baby needle. Patients have to have really good veins. So if you have tiny veins like I do, we got to work harder to get our bigger veins to be able to get bigger catheters in. You definitely want to preserve your red blood cells. You don't want any to break in the catheters. Therefore, the requirement of using a bigger gauge catheter is super important. Once the IVs have been inserted, the machines are hooked up. There's 4 major things that go into effect with EBOO. The first is the blood extraction. The blood is extracted out of a pull line. The pull line is then connected to a chamber. And we talked about the chamber. It acts like a dialysis machine, kind of just in your brain. And there's 2 things that happen in that chamber. The first one's oxygenation and ozonation. The blood passes through a specialized chamber where the oxygen is definitely medical grade, so you have to have a unit that converts medical grade oxygen to ozone gas, which is an extra oxygen molecule. Oxygen is considered O2, ozone is O3. And then once it's oxygenated, it's also ozonated simultaneously, so they're both having O2, O3 competing for your red blood cells in there. The third step of that is filtration. And filtration is super important for protocols like detoxification, getting rid of post-spike proteins from COVID infections or shots, chronic infections, viral infections, Lyme's disease, PANS, PANDAS. This is where it gets really nice because we're trying to remove any foreign body in terms of infections. If you're using either for detox or infection control, this becomes a super important state. So filtration is super important as well because it's connected to a canister, and you will see cell waste come out of it. It is very fascinating. For patients to see the waste coming out is almost like it's an important mental check to see, oh my God, my body has this much waste in it. They can see it, we can see it. It does sometimes have a smell depending on what we're treating. So we've had, I think what we've seen in practice, we've had a patient with glioblastoma stage 4 who had 2 full canisters of waste come out. To give you perspective of how much waste can come out. And these are huge canisters. I want to say about 2-3 liters. And then the last part is reinfusion. This is where the blood that's oxygenated, ozonated, and filtered is then passed through the UBI light, full spectrum, and returned back to the patient. So those are the 4 sort of what happens during the whole process. Runs for 50 minutes. We do check a blood sugar halfway, and we check a blood sugar at the end. We do keep snacks and things in the office to feed the patients, give them water, hydrate them, make them comfortable. So that's typically what an EBOO session looks like.
Okay. So what conditions have you used this in? And tell us about some of your results.
So we've used them for a variety of reasons. We've used them for neurological and neuroinflammatory conditions. We have a local psychiatrist we work with. He's a holistic psychiatrist. We see a lot of their patients. We use it for multiple sclerosis, Parkinson's, Alzheimer's. We've seen them for infectious issues or post-infection issues such as chronic Lyme disease, Epstein-Barr, cytomegalovirus virus is super common. Long COVID has been super common as well. Post-COVID neurological syndromes, which ties in with the psychiatric referrals. We've seen a whole lot of that. Mold and fungal infection, believe it or not, we're in Georgia. It's not as bad as I thought it was going to be, but we've had a significant number of patients that have struggled with mold toxicity that we've seen. Autoimmune conditions such as rheumatoid arthritis, lupus, Hashimoto's, psoriasis, chronic inflammatory response syndrome, inflammatory bowel, cardiovascular. We've seen patients with atherosclerosis, chronic ischemia, poor wound healing in relation to poor circulation, and also diabetes can kind of follow with that. So, and then, of course, oncology cases, variety of oncology cases. So one that stands out, one thing that I've seen is our mold patients, our autoimmune and mold patients. It's super fascinating because when we got trained with EBOO, they told us not to worry about, just because they have the waste coming out in the canister, that you've had a good session. You don't always have waste coming out. But those particular groups of patients, the amount of waste and the stickiness and the color and the smell, like you get, in the nursing field, you get obsessed with what's coming out. And the results that we've seen is patients take less medications and come off of their medications. Those are the big wins that we've seen on our end. For our psychiatry patients, it's reduction in dosages of their antipsychotics, antidepressants, and anti-anxiety to almost removal of some of those medications, which is huge when you're coming from a mental health facility with a ton of medications. So those are some of our success stories.
Wow. So you're telling us, that you're seeing people with psychiatric conditions come in, do EBOO, and they are able to lower the dosage on their medications and sometimes come off their medications?
That is correct.
Wow. Now that is truly fascinating. What kinds of psychiatric conditions?
The most common are schizophrenic patients and bipolar, but we do see a variety. ADHD is one common one, and then major depressive disorder, depression and anxiety is another big one.
Okay, so you're telling me patients that are bipolar and schizophrenic, challenging conditions to manage, are lowering their doses of their medications. I mean, that's just phenomenal.
It is, and it reduces
so
their
often,
side effect profile. Yes.
That, I'm speechless here, because so often what you see are people on multiple medications, and then they're on another medication for the side effect of the medications that they're on, because they don't want to take them off, or they've been on several already that didn't work, and this is the one that works, but they have a side effect, and so they give them a pill to treat the side effect. That to me, is such challenging diagnoses to have something like that. And you see this after how many sessions?
I would say an average of 4 to 6 sessions in combination therapies. Of course, you're doing other things in addition to EBOO. Yes.
But still, I mean, that's still quite amazing. And with but 1 minute, I tell you, these sessions go by so fast. I want to talk about COVID, because that is such an issue. You hear about people with long COVID and with the neurological things, and and also just, people maybe don't know this as much, but viruses can give you a post-viral syndrome. It's not just a COVID situation. So folks, hang on tight. We'll be right back. We're going to talk about a few other conditions that EBOO is helpful for. So hang tight.
Patty Conklin is busy, but she's never too busy for you, and there are lots of ways to get a healing session with her. You can even get one via Zoom or by phone. With 29 years in the business of energy healing, Patty has a unique and remarkable ability to connect with your energy to help you heal on a mind, body, spirit level. From angst to pain, you can get help from Patty. Book a half-hour healing session and embark on your own personal healing journey. Visit pattyconklin.com and click on services. That's pattyconklin.com.
If you're looking for unique items at affordable prices, then you should try Dream Product. From apparel to beauty, from shoes to therapeutic relief products, visit HealthyLife.net's advertiser page and click on Dream Products, and maybe your dreams might just come into reality.
Want to get that man or woman out of your mind? How about being in the right state of mind for getting that job promotion or staying positive to help boost your immune system? Want to break those old habits? Then it's time for an emotional cellular cleansing with Patty Conklin. You'll get a private 3-hour session in person by phone or by Zoom with 3 months of follow-up appointments, plus email support. But you'll have to do the work, and homework materials are included. Find out more or to book your appointment, visit pattyconklin.com. That's pattyconklin.com.
Get high-quality glasses, sunglasses, and prescription lenses at eyeglasses.com. Choose from over 250,000 items and 400 brands. Already have frames? Get replacement lenses. It's easy. Go to our advertiser page and click eyeglasses.com.
If you're wondering if Patty can help you heal, why not book a free 15-minute consultation either by phone or by Zoom? It's a great way to see which of Patty's services is right for you. You'll discuss her services in detail and how they can apply to your specific situation. It's really a great place to start, and you can sign up for your free consultation by phone or Zoom on Patty's website, pattyconklin.com. That's pattyconklin.com. Get the help you need today. Sign up for your free consultation at pattyconklin.com.
Radio your way. HealthyLife.net.
Well, folks, we're back with Chaitali Patel, and we are talking about EBOO, and at the just before this break, talking about EBOO being an integral part of treatment of people with psychiatric conditions, including bipolar and schizophrenia, which, at least in my world, these are folks that are challenging to treat. But before I forget, Chai, please tell folks how they can reach you. You're in the Atlanta area. Give them the contact information.
Yes, absolutely. So the name of the practice here is VITA, V-I-T-A, Infusions with an S. Our website is www.VITA, V-I-T-A, Infusions with an S, ATL for Atlanta.com. So that is, again, V-I-T-A, VITA, Infusions with an S, ATL.com. And our phone number is 470-796-3969. Again, it's 470-796-3969.
Excellent, excellent. Okay, so I'm still blown away at the improvements in those conditions that are just historically so challenging. But you mentioned ADD as well. Are you able to do this in children?
So we do children. We will use ozone therapy, which is a little bit safer than EBOO. We do have our cap at EBOO 14 and older for right now. Mm-hmm. We have some 14-year-olds that are, built like adults and so they can handle the metabolic stress from the EBOO treatments. So as of right now, we're not using EBOO in children, but we're doing ozone therapy in place of it. We just have to be more frequent and increase the gamma of ozone delivery.
And tell us about a condition that just blew your doors off, that you just were shocked at the improvement when you included this therapy.
So I have several amazing cases, and one of them that I just really, it stands out as we speak, is I had a 54-year-old woman, otherwise healthy, no medical history, maybe minor surgical history. She's in the Atlanta area. She's, a VP at a major corporation. When COVID started, she was one of those people pressured to get the COVID vaccine. Otherwise, she was going to lose her job. So what had ended up happening is her PCP didn't, quite screen her history of genetics, things like we check in the functional medicine world, like MTHFR, which is a methylation pathway, also responsible for detox. And what had happened to her is that she got her first COVID vaccine and had kidney injury and hypertension. I mean, I'm talking blood pressure of like 240 over 110. Like, she was taken to the ER. They couldn't bring her blood pressure down. She struggled with her blood pressure. She was a referral from a primary care doctor in the area. They didn't know what to do with her. She was on about 4 blood pressure medications when she got to Vita. We did an extensive intake. We introduced, our gut protocols, our IV therapies. EBOO was one of them. And her spike protein was super elevated. Of course, we knew she had an injury to the vaccine because she was not allowed to take any more based on the history. So she was a great case for EBOO because combined with other therapies, not only did she get off all 4 blood pressure medications, but she resolved all her chronic health conditions that kind of followed the post-vaccine injury situation. And I don't know of any other therapy in the conventional world that could have helped her at that point if she wasn't referred to it by a primary care doctor, who, by the way, definitely believes in what we do, so we work hand in hand here locally. But she was the one that, reminds me of how powerful EBOO treatments can be, because with a blood pressure that high, and, for people that don't know, that's a super high blood pressure, you could have other systemic issues, You could have cardiac issues, you could have kidney issues, you could have eye issues. I mean, high blood pressure has a lot of systemic outcomes if it's not controlled. And she was a classic example of what could have totally gone wrong had we not controlled those symptoms for her using the therapies that we here offer at Vita.
So is she on any blood pressure medicine now?
No, she's not. She takes no medication.
So she's back to her baseline?
Correct.
Of normal good health. See, this is why functional medicine is so important. The allopathic medical world would control the blood pressure with, a zillion medications, but there is no offer of an intervention to mitigate the effects of vaccine injury. I mean, this isn't a show about, whether vaccines are good or vaccines are bad. Okay. But the reality is that for some individuals, vaccines are toxic. I mean, in the same way that, certain foods are toxic for people. So this isn't a, a good or bad situation. For this individual, it was very bad. And had she not gone to you, her life would have gone in a very different direction. And with blood pressures that high, stroke was extremely likely if those blood pressures hadn't been controlled. And so, this scenario to me is just really highlights the powerful nature of a functional medicine assessment and obviously a willing client who's willing to do all these things, but this result is nothing short of amazing. We have a few minutes to go. Another case that comes to mind that maybe a different condition that you've...
Different case. So we have an oncology case with prostate cancer patient, 67-year-old male. He's actually from Colombia, sweet little guy. PSA, normal PSA, you would say below 4. You don't want it to be above. Those are kind of the ranges. This particular individual walked into my office with a PSA of almost 400, which I don't think I ever seen in my practice.
400?
400. Don't know the exact number, but it was definitely 400 in the 400.
Wow.
And I remember repeating it because I was like, there's just no way. They were given, of course, get your affairs in order. You only have a week. I think it was a week. They found Vita through another clinic here in the United States, the Reardon Clinic, that's known for its, integrative oncology care. Got to us, did all the therapies with us, including ozone therapy, high-dose vitamin C. But I want to just tell you, this was a story when I first got into Vita infusion practice about 10 years ago. He lived 8.5 years after that. So he saw 3 of his grandchildren after being given a week to live. And that, I think, was a very powerful case, not only for him, but for me. Because he came in here and I said, I don't know what to do for you, honestly. And he said, Chai, I have nothing to lose. And, he was right. He didn't. He didn't have anything to lose. And I'm glad I took that chance, and I'm glad I listened to him. And being fairly new in the game was something that always, I was like, okay, I have the information, I have the knowledge now, let's, like every provider out there, we learn new things come on, new research comes out, and you get this, knowledge base, which is just, we've read upon it and we know how it works. But then applications of medical knowledge tend to be difficult, right? You got to have patients that are willing to try, and providers that are willing to try as well.
Yes. I mean, there is no cookie cutter. Every person is different. And,
it is. And so now
while...
you're going to... Yes. Now you're going to...
Functional medicine has...
Customize.
Yeah. And functional medicine has a wide variety of tests, and there are newer tests coming online and better tests coming on. It's constantly evolving. But what's the best part is that this is individualized care. This isn't everybody gets the same thing. This isn't the protocol of, you got diabetes, so we're going to put a statin, we're going to do this, we're going to do that. And it's pretty much the same thing for everyone. Functional medicine and the care that you give at your clinic is individualized for that person. And another person can come in with the same thing and get different care. So, Chai, we have to go. The time goes by so fast. Thank you so much for joining me.
You're
this
very
has been
welcome.
So educational. And, folks, we'll see you next time. I actually don't know what's on board for us next week. I think it's just me and Patty. So, thank you so much for joining us. Chai, you take care. We'll talk soon. And everybody stay cool.